years-long collaborative project where we form a big right care family. I was just talking with Dr. Carol Zaher, a cardiologist sitting right behind you. Jacqueline, you're in good hands. Who first came to one of our right care meetings, probably at UCLA in 2008. And we have another one of our very early right care family members, Professor LaVonna Blair Lewis. LaVonna, would you raise your hand? She's a professor at the Price School of Public Policy, and she was one of my early encouragers. She had dual offices in Sacramento and Los Angeles, and right after I had started with zero resources, just looking at the data and feeling compelled to get people to come chip in to make something happen based on my love of data. I went to I was pre-med at UC Davis, and for those of you who don't know me that well, I do like to tell stories, and I think by personalizing things it kind of helps us all bond around our common mission. I am allergic to pretty much every antibiotic, so don't be offended if I'm constantly using hand sanitizer. But because of that, I didn't go to medical school when I was pre-med at UC Davis. I went to Harvard instead and studied how do you use data to drive public policy. So my master's is in public policy from the Kennedy School of Government, and I believe that government can be a force for good. And I come from a long line of proud civil servants, and I am so thrilled to have as my partners all of you, Professor Steve Chen from the School of Pharmacy and Professor LaVonna Blair Lewis. When they found out that we were having trouble finding a home in Los Angeles, when the Health Services Advisory Group, the federally qualified quality improvement organization, wanted to start something in LA, LaVonna is like, I've got this handled. You're going to come and you're going to be at USC. We'll figure it out. And since then, they introduced us to Dr. Carol Pedden, who has moved here from the United Kingdom, having been a very senior leader in the National Health Service, and now leads the University of Southern California School of Medicine Center for Innovation, and is our co-chair. And so with that, I think I should hand over the microphone and let people go around the room and introduce themselves and say something about what excites you in this area.
Do you want me to say something? Well, I'm really excited to see such a great audience today. There's so many people here, and I wanted to know, given to maybe a couple of months ago when I was last here, is it just that you haven't been able to make it, or is it this particular topic that has brought you here today? Are you regular attenders and you can make it today, or was it particular interest in this topic? If it was the topic, put your hand up. A few people, so it's really just you've made it. Great, welcome, nice to see you.
Yeah, hi there. I'm Dan Suzuki, a psychiatrist, and it's a real pleasure to be here today. And psychiatry often is separate from other fields of medicine, and certainly in this area of cardiovascular disease and medicine, we really want to partner together to work together to help patients. So I'm very excited to be here.
Microphone of truth.
Hi, I'm Julie Wang. I graduated here from USC School of Pharmacy back in 2008. I'm now a medical science liaison with Suzuki Pharmaceutical, and I'm excited about today's topic.
Hi, Steve Chen, I was introduced before. I'm chair of the clinical pharmacy department here at USC. My interest is in the fact that when you talk about reducing heart attacks and strokes, you're talking about optimal medication use to get that done. So I'm interested in how do we leverage this workforce of pharmacists who are trained to do this work, and how do we prepare our next generation of graduates to be successful in this area?
Hi everyone, my name is Stephen Van. I'm actually a pharmacy resident from Cedars-Sinai Medical Care Foundation. And it is actually my first time here, so I'm excited to see what this has to offer.
Hi, my name is Veronica, and I am Carol's project specialist at the Center for Health System Innovation.
I'm excited to be here because this is my first time at the event, so I'm excited to see how we're doing. Hi, I'm Pamela Barrett with Johnson & Johnson Healthcare Systems, and I'm a regular attendee. I'm always excited to be here because as I think this group does just fabulous work from a personal aspect, from the cardiovascular and having had a stroke in my family and looking at the impact of depression. So this is a topic that's very much of a great interest for me.
Hello, I'm Michelle Capel. I'm also with Johnson & Johnson Healthcare Systems. It's my first time, but I hear that this group does incredible work, so I'm happy to be here.
Hi everyone, I'm Whitney, and I'm actually really excited about this topic. My background is actually in public health and social work, so I feel like this topic really is like an intersection of focus. Hi, I'm Samantha Sweeney. I'm actually a clinical pharmacist, or used to be, but now I work for a pharmaceutical company called Otska and work in the managed care side. So it's my first meeting, but I look forward to many more.
My name is Lavana Lewis, and what interests me is I've been working around community-based interventions around cardiovascular disease and diabetes since 1999, and so very interested in the work, particularly how do you get community clinics involved as well.
Hi, good afternoon. My name is Eloisa Gonzalez. I'm Director for Cardiovascular and School Health with LA County Department of Public Health.
Thank you for making your way over today.
Hi, Dave Mitra. I'm with Health Services Advisory Group. I'm the Executive Director for the Physician Office, working on improving cardiovascular health, depression screening, and immunization in California.
Hi, Jeff Keats, Nova Nordisk. Obviously, working in the realm of diabetes and population health as it applies to diabetes, cardiovascular disease, depression, oftentimes are part of that mix. So it's great to see additional information that we can bring out to our providers.
Frank Carissimo with Nova Nordisk, and aside from being professionally linked to the diabetes piece, I have a lot of personal family history with the cardiovascular disease, so look forward to it.
Hi, I'm Cassidy Say. Actually, I'm new in my current position. I'm the Vice President for Business Development for CAPG, which is a trade organization that represents physician groups in IPA. We're no longer California, we're expanded outside of California. We have groups in IPA in 40 states now, so if you're interested to hear more about what I do, come on over, I'm learning also in the meantime. Prior to being here, I used to be the regional medical director at Blue Shield, and prior to that, I was the medical director at Greater Newport Physician.
And before we move on, I just want to say that Cassidy won a Right Care Initiative Award when she was medical director at Greater Newport Physicians. Through the team-based care model of adding a pharmacist to the care team, they were one of the top performing medical groups in the state for diabetes care. So she's a wonderful resource. Everybody get to know Cassidy.
We love Cassidy.
Yeah, happy to Cassidy. I'm Dr. Jean Shadadpur. I'm the Regional Medical Director for HealthNet, and before this I've been about 9 years with various IPAs. And I would like to be a regular attendee, but I think I'm pretty sporadic. It's definitely not my first time. And I think I would like to get involved more and more with the Right Care Initiative involving cardiac funds that we're trying to implement at various groups at healthcare.
Great, thank you.
Hello, my name is Sharon Tracy, and I've been here often, and my passion for cardiovascular disease and stroke prevention goes deep. And I recently made a career change because of it, joining a new company called AliveCore that has a one-lead EKG device that connects wirelessly to your phone and is a great tool to detect AFib. So happy, Hattie, for the invitation today. Thank you so much, and I'm just really passionate and I'm very interested in the topic as well. So thank you.
Hello, my name is Serena. I'm actually the Senior Business Analyst for Blue Shield, but I've actually been a regular attendee. Like Haiti, I'm very data-driven, but at the same time, cardiovascular disease speaks a lot to both personally with a lot of, actually lost a few friends this year due to heart attacks. So, but at the same time, I mainly focus with the Medicare population. and always trying to bridge the gap between, the health plan, pharmacy, as well as the dentist. So,
If you
excited to
feel
be here.
comfortable, can you elaborate on the ages of your friends that you lost, and were they here in Los Angeles? Because that's the data I'm looking at right now, is really large numbers of heart attacks here in
There's
Los
actually
Angeles.
quite a few. One of them, he was actually 47 this year when he passed away. And, like I said, they're very, very healthy. He's an active climber, and just one day when he was driving his car back, it just happened. And, it's definitely the prevention, I have to say. That's something that he lacked. He always spends the weekend out climbing. And I had another friend that was actually advisory group when I was at Loma Linda, and he actually passed away a couple of days ago. He was 47, and he was a cardiologist himself. So,
He was a cardiologist.
That's the unfortunate thing, is many times it's all about detection and prevention. So I am very happy with what this group has done and continue to do. So.
Thank you for being willing to share that.
Hi, I'm Dr. Carol Zier. I am a cardiologist, and I work in health data in the Appeals and Grievance Department. And yes, Hattie and I met in, I guess it was about 2008 with the initial Right Care Initiative movement, and then I backed out for a bit, and now I'm back for the last couple sessions, and I hope to come regularly. I will say, as I get older, cardiovascular disease becomes even more important to me personally, just by age. But I guess the studies that came out this week suggest that cancer may be overtaking cardiovascular disease and mortality in at least, I think about 21 states. But some of that is because cancer is increasing in mortality. But we are making somewhat of a dent if you look at the statistics. We are doing better in cardiovascular disease. So hopefully our organizations like the Right Care Initiative can continue to make an impact on that as we go forward. Thank you.
Thank you.
Hi, everybody. This is my first meeting. My name is Oji Geratsian, and I'm with the Department of Public Health here in LA County, and I'm the director of the Medical Affairs Unit. And we are looking for opportunities to partner with the county, different groups and different plans and different health systems and hospitals and clinics to promote best practices and evidence-based guidelines. So I'm here to learn. If you would like to reach out, please come find me.
Hi, I'm Amy Deshbali, and I'm a compliance officer with All Inclusive Community Health Center, which is Federally Qualified Health Center. So I'm always excited to be here and to hear the news, whatever is out there, and to go back and try to explain to everyone that try very hard to do what we are doing right now.
Hi, everyone. I'm stealing the microphone from Kelly because I wanted to take this opportunity to introduce my partner, one of my administrative partners. So I'm Tim Ho, I'm a family medicine doc from Kaiser Permanente in Orange County. I attend regularly as much as possible. And I just wanted to introduce Kelly Green, our consultant for cardiovascular disease with the Med Group here in Southern California. So I'll give you the microphone back.
Thanks, Tim. I'm interested in the topic. I work in population care for CVD and diabetes, and depression is so in there and so important, and I'm really interested in the topic. And I also really liked what you said, Hattie, about government can be a good force in healthcare. And I enjoy policy, and I liked that a lot.
Good afternoon, I'm Lloyd Serino, the clinical manager for Wells Pharmacies, and I'm also a regular attendee. And I'm always excited to hear about what best practices these different organizations have that lead them to the great outcomes that they have. And also to be a proponent for using, like Steve said, especially community pharmacists to be part of the care teams. I think a lot of times we're underutilized and we can do more, and I'd love to be able to be part of that.
Hi everyone, my name's Elaine. I recently graduated from Western U College of Pharmacy. Very excited to be here. It's my first time, but I'm really interested in the topic. So my dad actually had a stroke. So similar to Steve and Lord, I want to find other opportunities to help manage these types of patients, especially at a community pharmacy level.
Hello, my name is Whitney Franz, and I'm the QI Program Manager at the LA Practice Transformation Network. And my background, I'm actually a registered dietitian, so I'm always about prevention. And I actually worked on the Johns Hopkins blood pressure hypertension study with Dr. Cooper for about 3 years before I moved here, working on care management with pharmacists embedded in primary care doctors' offices. But I think that the topic today links perfectly with our LAPTN goals around diabetes and depression management in LA County. And yeah, look forward to hearing more.
Hi, I'm Amanda. I am a research assistant with the Right Care Initiative. I just graduated from UC Berkeley, and I'm, like how you said, I'm applying medical school right now. And being in the room here is really a privilege for me that I think a lot of my colleagues and peers don't ever get. And so, no matter what the topic is, and this topic has a lot of significance for me because cardiovascular disease is pretty prevalent in my family. But it is always great for me to be here and learn more and speak to a bunch of amazing people who are doing what I want to do, hopefully, in the future. So, thank you.
Thank you. Thank you. So, my name is Mary Ferguson. I'm the Chief Medical Officer for Health Services Advisory Group, and we're a partner here at, with Hattie, and along with Carol and Steve and everybody else supporting the Right Care Initiative. I'd like to point out to you briefly, in your packet is this yellow form, which is an evaluation form, and we'd love for you to fill it out before you leave. And especially for those who are looking for CE and for CME credits, and CME credits are provided by LA Care Health Plan. And so this is very important. If you want to get your CME and CE, please fill it out. But if you don't, you should fill it out too, because we would love to hear your feedback. So today we're really very pleased to have Dr. Suzuki with us. He, as you can see from his biographical sketch, he is a distinguished medical director of the Las Encinas Hospital, which is a freestanding 110-bed psychiatric acute care hospital in Pasadena. And he's also an adjunct clinical associate professor of psychiatry at the USC Keck School of Medicine and the Graduate School of Psychology, Fuller Theological Seminary. So with that, I'd like to turn this over to Dr. Suzuki.
Thank you.
You have your, use this or?